The power of people and place in promoting community well-being. Chapter 1, Introduction. I'm delighted to introduce the 2024 Director of Public Health's annual report, which focuses on the power of people and place in promoting community well-being. Health and well-being are more than just avoiding illness or having access to healthcare. They include the ability to enjoy activities and generally have the resources needed to feel satisfied in life. Our surroundings, from where we are born to where we grow, live and age, greatly affect our health and well-being. To make a difference, we need to focus on factors such as our communities, environment, transport, work and housing as key building blocks of health. So this year's report celebrates the positive efforts in Warwickshire to address these areas. We recognise that these are challenging times for many, but despite the difficulties, there is much to be proud of. We will share what residents value about their local areas and some examples of good work. We hope this report inspires, encourages reflection and sparks conversation on how we can work together to improve these building blocks of health. Chapter 2. What builds a community?
Let's hear from the people of Warwickshire about what they most like where they live. In May 2024, Warwickshire County Council conducted a survey with the Voice of Warwickshire panel to gather their thoughts on their positive experiences about where they live. The panel represents the diverse population of the county. 444 members took part in the survey. The panel were asked what they liked most about where they live. This was an open question with no list to choose from. They were free to say whatever they liked. All responses were read and grouped together. The most popular replies, from around half of respondents, said they most liked the open and green spaces around them.
Open rural space for my children to explore and grow up in. It feels so safe, and I feel very lucky to live here.
I love our green spaces, ancient woodland and country parks.
The second most popular responses were those that referenced the closeness to amenities, with around a third of people mentioning it.
Proximity to shops and services, whether walking, cycling or driving our location, is very convenient.
I love that it's a short walk to the town and nearby facilities. I have a GP surgery, shops, community centre, public house and lovely open spaces for walks right on my doorstep.
The next most popular theme highlighted community and neighbours, with a quarter of responses.
The keen sense of community. There is very much a sense that we're all in this together.
Like-minded people who have respect and pride in the area we live in. It is clean, maintained and has a mix of housing.
While these were the top 3 themes, so many different responses were given. Here are just some. The panel were asked what aspects of where they live has the biggest positive impact on their health and well-being. Just under a third emphasised open and green spaces, again showing the value Warwickshire residents place on the natural environment.
Being surrounded by and able to easily access nature and greenery is great for my mental health and my physical health.
The panel were also asked to choose from a list of options about how they are involved in their local community. The top 2 responses were physical activity at 35%, volunteering at 30%. 3/4 of respondents were involved in one or more community activity.
Chapter 3. Why is community-based well-being important?
Our daily activities play a role in maintaining our health and well-being. Things like community networks and groups, access to green spaces and enjoyable leisure activities all contribute to improved health and well-being. Well-being is more than just the absence of ill health. In its simplest form, it's about feeling good and feeling that the everyday things we do are meaningful and worthwhile. Well-being is influenced by physical and mental health and has an impact on our experience of different health conditions. So, what about well-being in Warwickshire? There are over 600,000 people living in Warwickshire, enough to fill Wembley Stadium 6.5 times. Each one of us living a completely unique life, from where we live, who our family and friends are, the communities around us, and how we spend our time. According to the annual population survey, in Warwickshire, 3 in 4 people scored their happiness as high or very high. We know that a person with good well-being will have better physical and mental health. 4 out of 5 residents in Warwickshire also stated that they are in good or very good health. Our physical and mental health is shaped by the conditions in which we are born, grow, live, work and age. Healthcare only accounts for 20% of our health and well-being. The remaining 80% is the result of the building blocks of health, such as employment, housing, communities, and our health behaviours. However, policy decisions often focus on treating illnesses. Community assets help to boost our health and well-being. In Warwickshire, we have a variety of community assets, such as country parks, community centres, village halls, libraries, allotments, schools, and many more. Volunteering and getting involved in your community can improve your life through friendships, shared skills and knowledge, or being neighbourly. Helping others can help you. Local groups and activities can contribute to health and well-being and give you a sense of belonging. Many Warwickshire residents already take part in a variety of voluntary activities. Warwickshire Community and Voluntary Action supported nearly 1,500 activities at over 900 different groups. 6 voluntary and charitable organisations across Warwickshire were awarded the King's Award for Voluntary Service in 2023. Around 2,000 people took part in a Warwickshire 5-kilometre volunteer park run on just one Saturday in May 2024. These are just a few examples that celebrate the power of people and place.
Chapter 4. Case Studies.
Green spaces in Warwickshire include public spaces, such as parks, playgrounds, canals, cycle routes, woodlands, nature reserves, allotments and private gardens. Green spaces are often free to access and are places for being active, playing, socialising, relaxing and connecting with nature. Green spaces can support good physical and mental health, help recovery from illness and improve quality of life at all life stages. We are often more active in green spaces. Being active is one of the cheapest and best ways to improve health and well-being. Spending time in green spaces can help you feel more connected by taking part in shared social activities, reduce stress and anxiety, help reduce levels of air pollution. Green spaces are maintained by many valued volunteers, as well as work experience placements, which take place in our country parks, schools and local colleges. There are many green shoots projects which save carbon, enhance biodiversity, or address climate adaptation. We can all connect with nature to boost our well-being. Whether this is in a local park, a tree-lined street, a private garden, or by planting a window box. You can also visit one of Warwickshire's 5 country parks or 3 greenways, all of which cover 1,200 acres of the county's countryside and attract over 1 million visitors every year. Warwickshire libraries play a vital role in supporting community health and well-being. Let's see how our libraries contribute at every stage of life. For early childhood, libraries offer rhyme time for parents and carers and their little ones to come and sing songs together. Teenagers and adults can benefit from the You Can Online programme, offering essential digital skills and IT support. Libraries also offer homework support, providing a quiet space and resources for young people. For adults of all ages, groups like Knit and Natter enable people to get together and share common interests. There are also new electric mobile libraries that make book browsing more accessible for those who need it. Warwickshire libraries also promote social interaction and mental well-being through activities like board games, access to musical instruments, and bringing people together in a fun and engaging way. From early literacy to digital skills, social activities to mental health support, Warwickshire's libraries are community hubs promoting well-being for all life stages. Communities are broadly defined as groups of people based on a geographical area, an interest, or a sense of identity. The act of belonging and having a sense of community is essential for people to thrive. The COVID-19 pandemic, the increased cost of living, and the response to international conflict has demonstrated how communities come together in the face of common challenges to ensure the safety and well-being of the people around them. Strong communities are vital, but they don't just happen. They require support and investment to help them thrive, grow, take action, and lead for themselves. It is more important than ever that we work alongside these communities and recognise their strengths, power, and commitment to making positive changes where they live. Let's now look at how local activities and groups can contribute to health and well-being. Volunteering, participating in organised activities, or simply connecting with people can really improve how you feel. There are a lot of fantastic activities happening across Warwickshire, most of which are led, driven and resourced by people living in the community. Let's look at a few examples. The Kingsbury Jigsaw Puzzle Lending Library offers a space to chat and have a drink while choosing a puzzle to borrow. Nuneaton Men and Women in Sheds provides a safe space for people to come together, meet new people, and make things for the local community whilst learning and sharing skills. A local church and school in Brownsover identified that families in the area were struggling financially. A local partnership was formed, and Christchurch continued to provide a warm social space and hot meals for any families in need over the winter months. The community in Lillington East have worked with the councils and other organisations to identify the things that matter most to them. The ideas and activities that came from this all aim to improve the well-being of the local area, and they got a camel. The Crafty Lunch Club in Ulster hosts a weekly social group for adults with learning and/or physical disabilities and their carers, run mostly by volunteers. We hope these examples have shown how community activity can promote good health and well-being. Why not find out about local groups in your area? For a healthy community to flourish, it's essential to have key building blocks in place, such as stable jobs with fair salaries, quality education, efficient transport, and good housing. Here are a few more examples of this in practice in Warwickshire. Digital connectivity and access to transport is important for our health and well-being. Reliable and accessible public transport and good active travel options can help people stay socially connected, reach jobs and schools, and access services in a healthy and active way. Indigo is a demand-responsive bus service in Warwickshire. If you have mobility issues or don't have easy access to other public transport options, this dial-up or app-based service will take you where you want to go within many parts of the county. It is well evidenced that being in good employment is good for your health and well-being. The Warwickshire Skills Hub supports businesses and schools with their career agenda and helps individuals gain the competencies needed for secure employment. Housing is another key building block, with a number of factors contributing to health and well-being, such as access to nearby amenities, adequate living space, and homes in good condition. The Home Upgrade Grant and the Local Authority Delivery Scheme, managed by the district and borough councils, help to improve energy efficiency in homes, particularly targeting low-income households and those in fuel poverty. To address these factors effectively, a joined-up approach is essential to understanding how these different building blocks can impact our health and well-being.
Chapter 5, Summary and Recommendations. This report has highlighted some of the key factors that contribute to community-based health and well-being and the role that people and place play in this. Here are my recommendations for Warwickshire. The power of built and natural assets. We value the many and varied assets that we have across Warwickshire and make the best use of the spaces and places that are available to ensure that everyone has access and choice. The power of communities. It is more important than ever that we work alongside people and communities and recognize their strength, power, and commitments to make positive changes where they live. We recognize and celebrate the contributions that people and communities make to improving health and well-being. The power of relationships. We value the voice and contribution of all communities and partners and recognize that thriving communities and services are built on relationships and trust. We listen to the voices of people living and working in Warwickshire and actively look for ways to engage with everyone. These shared values enables all of us to make positive changes that improve health and well-being. The power of working together. Great well-being comes from looking at all aspects of life. We create and embrace opportunities for partnership working that promotes a holistic view of health and well-being to ensure that this is embedded in everything we do. The power of prevention. Health and well-being is much more than the absence of illness. We recognize the impact that the social, environmental, and economic environment has on creating the conditions for healthy lives. We prioritize preventative action to keep people and communities healthy and help reduce the demand on our local health services. The power of the possible. We believe that a healthy community for all is achievable. We support individuals and organizations to recognize their potential and take opportunities to tackle inequalities and make a positive difference. Thank you for watching the Warwickshire Director of Public Health Annual Report 2024. We hope it has illustrated the connection between well-being and our communities and the places we live, and inspired you to celebrate and make use of the many assets we have available in Warwickshire to help us all lead a healthier life. If you want to have your say, we would love to hear from you. Why not use a dialogue tool to share your views and experiences?